Question 1. A pharmacy technician is checking the expiration dates of medications on a shelf. Which of the following medications, if found expired, poses the most immediate safety risk if administered? A. Ibuprofen tablets. B. Oral penicillin suspension. C. Sterile injectables. D. Topical hydrocortisone cream. Answer: C. Sterile injectables. This question tests understanding of medication storage and stability, specifically identifying high-risk expired products. The keyword most immediate safety risk highlights the need to identify which dosage form is critically important to keep sterile and potent. Sterile injectable medications must maintain sterility to prevent serious infections when injected into the body, and using an expired injectable could mean it's no longer sterile or potent. For example, administering an expired fluid could introduce bacteria directly into a patient's bloodstream. Always prioritize checking expiration dates on sterile products like injections and eye drops. Question 2. A prescription reads lisinopril 10 mg Sig, 1 tab PO daily DISP, number 90. How many days supply is this prescription for? A. 30 days. B. 60 days. C. 90 days. D. 120 days. Answer: C. 90 days. This question tests basic prescription interpretation and calculating days supply. The key instruction is Sig, 1 tab PO daily, meaning 1 tablet by mouth every day, and DISP, number 90, indicates 90 tablets are being dispensed. To find the day's supply, you divide the total quantity dispensed by the daily dose. 90 tablets / 1 tablet per day equals 90 days. If a patient takes 1 pill each day and receives 90 pills, they have enough medication for 90 days. Always double-check the Sig, instructions, and the DISP, quantity, to accurately calculate the day's supply. Question 3. According to federal law, a prescription for a Schedule II controlled substance must be filled within what time frame from the date it was written? A. Within 6 months. B. Within 90 days. C. There is no federal time limit, but state laws may apply. D. Within 7 days. Answer: C. There is no federal time limit, but state laws may apply. This question assesses knowledge of federal controlled substance regulations regarding prescription validity. The key phrase is federal law concerning Schedule II controlled substance. While many people assume a strict federal time limit, federal law itself does not specify an expiration date for Schedule II prescriptions. However, state laws do often impose such limits, commonly 6 months. You must always be aware of and follow both federal and state laws, but nationally, the limit is determined by individual states. Remember that state laws governing pharmacy practice often add requirements beyond federal minimums, especially for controlled substances. Question 4. What is the primary purpose of a formulary in a healthcare system or insurance plan? A. To list all available medications in the world. B. To provide a list of preferred medications covered by the plan. C. To track medication errors. D. To set the prices for medications. Answer: B. To provide a list of preferred medications covered by the plan. This question tests understanding of common pharmacy benefits management terms. A formulary is essentially a list of prescription drugs covered by a prescription drug plan or hospital, and the term primary purpose asks for its main function. Formularies are curated lists of medications that the plan or system prefers to cover, usually due to cost-effectiveness and clinical efficacy. Patients or prescribers typically choose medications from this list to ensure coverage and lower costs. Think of a formulary as a menu of approved and covered medications your insurance company will help pay for. Question 5. patient is taking warfarin, Coumadin. Which of the following laboratory tests is routinely used to monitor the effectiveness of warfarin therapy? A. CBC, complete blood count. B. BMP, basic metabolic panel. C. INR, international normalized ratio. D. A1C, hemoglobin A1C. Answer: C. INR, international normalized ratio. This question assesses knowledge of monitoring parameters for common medications, specifically warfarin. Warfarin is an anticoagulant, meaning it prevents blood clots, and the keyword monitor the effectiveness asks how its blood thinning effect is measured. The INR is a standardized test that measures how long it takes for a patient's blood to clot compared to a normal sample, providing a consistent way to monitor warfarin's therapeutic effect regardless of the lab performing the test. For instance, a target INR range is typically 2.0 to 3.0 for many conditions requiring blood thinning. Recognizing that warfarin needs regular INR checks is crucial for patient safety. Question 6. Calculate the flow rate in ml/hour for an 4 infusion of 1,000 milliliters of D5W to be infused over 8 hours. A. 80 milliliters per hour. B. 100 milliliters per hour. C. 125 milliliters per hour. D. 150 milliliters per hour. Answer: C. 125 milliliters per hour. This question tests basic flow rate calculation. You are given the total volume, 1,000 milliliters, and the total infusion time, 8 hours, and asked for the rate in ml/hour. To find the rate, you divide the total volume by the total time. 1,000 milliliters/8 hours equals 125 milliliters per hour. This calculation tells you how many milliliters need to be delivered every hour to complete the infusion within the specified time. When calculating flow rates, always ensure your units match the required output units, ml/hour in this case. Question 7. Which of the following professional journals is a primary resource for pharmacists and pharmacy technicians for news, clinical reviews, and continuing education? A. New England Journal of Medicine. B. Journal of the American Medical Association, JAMA. C. American Journal of Health System Pharmacy, AJHP. D. Nature. Answer: C. American Journal of Health System Pharmacy, AJHP. This question assesses familiarity with professional pharmacy resources. You're looking for a journal specifically catering to pharmacists and pharmacy technicians, covering relevant professional content. AJHP is a widely recognized, peer-reviewed journal published by the American Society of Health System Pharmacists, focusing on topics relevant to pharmacy practice in hospitals and health systems, including clinical, administrative, and technician-specific content. While the other options are reputable medical journals, AJHP is the most specific and primary resource for the pharmacy profession among the choices. Knowing key professional journals helps you find reliable information for your practice. Question 8. What is the primary role of the Pharmacy and Therapeutics (P&T) Committee in a hospital setting? A. To hire and fire pharmacy staff. B. To manage the hospital's budget for all departments. C. To evaluate and approve drugs for the hospital formulary and develop prescribing guidelines. D. To handle patient billing for pharmacy services. Answer: C. To evaluate and approve drugs for the hospital formulary and develop prescribing guidelines. This question tests understanding of institutional pharmacy committees and their functions. The Pharmacy and Therapeutics (P&T) Committee is a key group in hospitals responsible for making decisions about medications used within the institution, and the primary role is its main purpose. This committee, typically composed of pharmacists, physicians, nurses, and administrators, reviews drug efficacy, safety, and cost-effectiveness to decide which medications are included on the hospital's formulary and to create policies for their use. Their decisions directly impact what medications are available for patient care. Understanding the P&T Committee's function is essential for recognizing how medication use is managed in hospitals. Question 9. A prescription is received for azithromycin 500 mg Sig, 2 tabs PO x 1 day, then 1 tab PO daily x 4 days. How many tablets should be dispensed in total? A. 4 tablets. B. 5 tablets. C. 6 tablets. D. 7 tablets. Answer: C. 6 tablets. This question tests careful interpretation of dispensing instructions, especially for tapered or short course regimens. The prescription has 2 parts to the Sig. First, 2 tabs PO x 1 day, meaning take 2 tablets on the first day, and second, then 1 tab PO daily x 4 days, meaning take 1 tablet each day for the following 4 days. To find the total quantity, add the number of tablets from each part. 2 tablets, day 1, plus 4 tablets, days 2 to 5, equals 6 tablets total. Always break down multi-step dosing instructions to ensure you calculate the correct total quantity to dispense. Question 10. Which of the following abbreviations is correctly interpreted as needed? A. AC. B. PC. C. PRN. D. BID. Answer: C. PRN. This question tests knowledge of common prescription abbreviations. You need to identify the abbreviation that translates to as needed. PRN is the standard medical abbreviation derived from the Latin pro re nata, which means as needed. The other options represent different timings. AC means before meals, PC means after meals, and BID means twice a day. Memorizing common abbreviations is crucial for accurately reading and processing prescriptions. Question 11. A pharmacy receives an electronic prescription. What is the best way to verify the prescription's authenticity? A. Assume all electronic prescriptions are valid. B. Call the patient to confirm they sent it. C. Verify the prescriber and their information through a reliable source or the electronic prescribing system. D. Check if the drug is commonly prescribed. Answer: C. Verify the prescriber and their information through a reliable source or the electronic prescribing system. This question addresses quality assurance and verifying prescription legitimacy, particularly with electronic prescriptions. While electronic prescriptions reduce some risks, verifying the authenticity of the prescriber and the prescription itself is still a crucial step. Relying on a trusted electronic prescribing system or cross-referencing the prescriber's information against known databases or contact information is the most reliable method. Calling the patient doesn't verify the prescriber's identity, and simply assuming validity or checking commonality are insufficient safety checks. Always prioritize verifying the source of any prescription, especially in the digital age. Question 12. Which of the following medications is commonly used to treat type 2 diabetes mellitus? A. Lisinopril. B. Metformin. C. Atorvastatin. D. Amoxicillin. Answer: B. Metformin. This question tests knowledge of common medications for chronic conditions, specifically type 2 diabetes mellitus. You need to identify the drug from the list that is primarily used for managing blood sugar in diabetic patients. Metformin is a widely prescribed oral medication that helps lower blood glucose levels in people with type 2 diabetes, working by reducing glucose production in the liver and increasing insulin sensitivity. Lisinopril treats high blood pressure, atorvastatin treats high cholesterol, and amoxicillin is an antibiotic. Recognizing the therapeutic class of common medications is fundamental. Question 13. In the pharmacy, the term DEA number is primarily associated with prescriptions for which category of medications? A. Over-the-counter, OTC, medications. B. Legend drugs, prescription only. C. Controlled substances. D. Investigational drugs. Answer: C. Controlled substances. This question tests knowledge of regulatory requirements for different drug categories. The DEA number, Drug Enforcement Administration number, is a unique identifier assigned to prescribers who are authorized to prescribe controlled substances. This number is a mandatory piece of information required on prescriptions for medications classified under the Controlled Substances Act. While prescribers have licenses for all prescription drugs, the DEA number is specifically tied to their authority to handle controlled substances. Seeing a DEA number on a prescription is a clear indicator that the medication is a controlled substance. Question 14. A patient brings in a prescription for eye drops. Where should these be stored in the pharmacy? A. In the refrigerator, regardless of the drug. B. In the freezer. C. According to the manufacturer's specific storage instructions. D. On a regular pharmacy shelf at room temperature. Answer: C. According to the manufacturer's specific storage instructions. This question emphasizes the importance of following specific medication storage requirements. The keyword eye drops doesn't automatically dictate storage. Different eye drop formulations have varying stability requirements. The manufacturer's specific storage instructions, typically found on the packaging or in the drug information leaflet, are the definitive source for how a medication should be stored to maintain its potency and safety. Some eye drops require refrigeration, while others are stored at room temperature. Always check the product label or package insert for precise storage instructions. Question 15. Convert 500 milliliters, ml, to liters, L. A. 0.5 L. B. 5 L. C. 50 L. D. 5000 L. Answer: A. 0.5 L. This question tests basic metric system conversions, specifically between milliliters and liters. There are 1000 milliliters in 1 liter. To convert milliliters to liters, you divide the number of milliliters by 1000. So, 500 milliliters / 1000 milliliters per liter equals 0.5 L. Understanding how to convert between common metric units like ml and L is essential for accurate dosing and calculations in the pharmacy. Question 16. What is the purpose of the TALLman lettering system used for some drug names? A. To indicate the drug strength. B. To highlight parts of drug names that look or sound similar to reduce mix-ups. C. To show that the drug is a controlled substance. D. To denote that the drug is available over the counter. Answer: B. To highlight parts of drug names that look or sound similar to reduce mix-ups. This question is about medication safety initiatives, specifically related to lookalike/soundalike, LASA, drugs. TALLman lettering is a strategy where specific letters in drug names are capitalized to emphasize the differences between names that might otherwise be confused. For example, hydralazine and hydroxyzine use TALLman lettering to prevent errors. This technique is a visual aid designed to reduce dangerous medication errors caused by confusing drug names. Paying attention to TALLman lettering on product labels and pharmacy software helps prevent dispensing the wrong medication. Question 17. A patient calls asking if a medication is gluten-free. Which section of the drug information source, like a package insert or reliable database, is most likely to contain this information? A. Indications. B. Contraindications. C. Description/ingredients. D. Adverse reactions. Answer C. Description/ingredients. This question tests where to find specific non-clinical information about a medication's composition. The patient is asking about whether the drug contains gluten, which is an ingredient consideration. The description or ingredients section of a drug's official information source lists the inactive ingredients used in the formulation, including fillers, binders, and coatings, which is where information about potential allergens like gluten would be found. While other sections are important for clinical use, the ingredients list is where to look for specific formulation components. Always check the inactive ingredients section for information about potential allergens or dietary restrictions. Question 18. What does the abbreviation NPO mean on a patient's chart or medication order? A. Notify primary physician. B. Nothing by mouth. C. New prescription ordered. D. Needs pain observation. Answer B. Nothing by mouth. This question tests knowledge of common medical abbreviations used in patient care settings, particularly in hospitals. NPO is a widely used medical abbreviation derived from the Latin nil per os, meaning nothing by mouth. This instruction is crucial for patients who are preparing for surgery, undergoing certain medical tests, or have conditions that prevent oral intake. Following NPO status is vital for patient safety and procedural success. When you see NPO, understand it means the patient cannot eat or drink anything. Question 19. Calculate the day supply for a prescription written for eye drops with the instructions 1 drop in each eye twice daily and a bottle size of 5 milliliters. Assume there are approximately 20 drops per ml. A. 25 days. B. 50 days. C. 75 days. D. 100 days. Answer A. 25 days. This question requires calculating day supply for a liquid medication using drop conversion. The instructions are 1 drop in each eye twice daily, meaning 2 drops per dose, taken twice a day, for a total of 4 drops per day, 2 drops/dose * 2 doses/day. The bottle is 5 milliliters, and there are 20 drops/ml, so the total number of drops in the bottle is 5 milliliters * 20 drops/ml equals 100 drops. To find the day supply, divide the total drops by the daily drop usage. 100 drops/4 drops/day equals 25 days. Pay close attention to the number of eyes and the frequency when calculating drop usage. Question 20. Which section of the Safety Data Sheet, SDS, formerly known as MSDS, provides information on handling and storage of a hazardous substance? A. Section 4, First Aid Measures. B. Section 7, Handling and Storage. C. Section 8, Exposure Control/Personal Protection. D. Section 11, Toxicological Information. Answer B. Section 7, Handling and Storage. This question tests knowledge of safety data sheets, which are crucial documents for workplace safety, especially when handling chemicals or hazardous substances. An SDS is standardized into specific sections, and the question asks where to find information on handling and storage. Section 7 of an SDS is specifically dedicated to providing guidelines on how to safely handle and store the material, including precautions to prevent spills and recommendations for storage conditions. Knowing the layout of an SDS helps you quickly find critical safety information. Question 21. A patient is prescribed amoxicillin suspension and weighs 44 pounds. The dose required is 20 milligrams per kilogram per day divided into 3 doses. The suspension concentration is 250 milligrams per 5 milliliters. How many ml should the patient receive per dose? Note, 1 kilogram equals 2.2 pounds. A. 1 milliliter. B. 2 milliliters. C. 3 milliliters. D. 4 milliliters. Answer: C. 3 milliliters. This question requires multiple steps involving weight conversion and dosage calculation for a pediatric patient. First, convert the patient's weight from pounds to kilograms. 44 pounds/2.2 pounds per kilogram equals 20 kilograms. Next, calculate the total daily dose in milligrams. 20 milligrams per kilogram per day * 20 kilograms equals 400 milligrams per day. The dose is divided into 3 doses, so the dose per administration is 400 milligrams/3 doses is almost equal to 133.3 milligrams per dose. Finally, convert the dose from milligrams to milliliters using the suspension concentration, 133.3 milligrams/250 milligrams, * 5 milliliters equals 2.66 milliliters. Rounding to a practical volume for dispensing, 3 milliliters is the closest and most appropriate answer among the choices. Remember to convert weight to kilograms before calculating milligram doses based on mg/kg, and then convert the milligram dose to milliliters using the concentration. Question 22. According to HIPAA, what is the primary purpose of protecting protected health information, PHI? A. To allow healthcare providers to share patient information freely. B. To ensure patient privacy and the security of their health information. C. To make it easier for pharmaceutical companies to market drugs. D. To standardize billing codes for insurance claims. Answer: B. To ensure patient privacy and the security of their health information. This question tests understanding of the Health Insurance Portability and Accountability Act, HIPAA, a fundamental law in healthcare. The primary purpose of HIPAA's privacy and security rules is to protect protected health information, PHI, which includes any information about a patient's health status, provision of healthcare, or payment for healthcare that can be linked to a specific individual. HIPAA establishes national standards to prevent unauthorized disclosure of this sensitive information. Protecting patient privacy is a core ethical and legal responsibility in pharmacy practice. Question 23. Which of the following tasks is typically outside the scope of practice for a certified pharmacy technician? A. Entering new prescription information into the pharmacy system. B. Counting and labeling medications for dispensing. C. Counseling a patient about the potential side effects of a new medication. D. Preparing sterile intravenous admixtures. Answer: C. Counseling a patient about the potential side effects of a new medication. This question assesses the boundaries of a pharmacy technician's role versus a pharmacist's role. While technicians perform many vital tasks, counseling a patient about potential side effects requires clinical judgment and in-depth drug knowledge that falls under the responsibilities of a licensed pharmacist. Pharmacists are trained to assess individual patient needs, interpret complex drug information, and provide personalized counseling. Technicians can assist in gathering information or handing out pre-printed materials, but the act of patient counseling on drug effects is reserved for the pharmacist. Question 24. A pharmacy technician is preparing a prescription for a medication that requires refrigeration. What temperature range should the pharmacy's refrigerator maintain? A. Below 0 degrees Celsius 32 degrees Fahrenheit. B. 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit. C. 15 degrees Celsius to 30 degrees Celsius, 59 degrees Fahrenheit to 86 degrees Fahrenheit. D. Above 30 degrees Celsius 86 degrees Fahrenheit. Answer: B. 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit. This question tests knowledge of proper storage temperatures for refrigerated medications. Medications requiring refrigeration need to be stored within a specific cold temperature range to maintain their stability and effectiveness. The standard temperature range for pharmacy refrigeration is 2 degrees Celsius to 8 degrees Celsius, equivalent to 36 degrees Fahrenheit to 46 degrees Fahrenheit. Temperatures below freezing can damage some medications, while temperatures above this range may cause degradation. Ensuring accurate refrigerator temperature monitoring is a crucial quality assurance step. Question 25. What is the primary goal of a continuous quality improvement (CQI) program in a pharmacy? A. To reduce the number of staff working in the pharmacy. B. To identify and resolve problems to improve patient care and safety. C. To increase the prices of medications. D. To focus solely on increasing prescription volume. Answer: B. To identify and resolve problems to improve patient care and safety. This question tests understanding of quality assurance principles in pharmacy practice. Continuous quality improvement, CQI, is a systematic process used in healthcare to identify areas for improvement in processes and outcomes, with the ultimate goal of enhancing patient care and safety. CQI involves continuously monitoring performance, identifying errors or inefficiencies, implementing changes, and evaluating the impact of those changes. The focus is on creating a culture of safety and excellence. CQI is not about cutting staff or raising prices, but about making pharmacy services safer and more effective for patients.